everyone. I'm Dr. Walter Rosenfeld, and it's a pleasure to be here today. I'm the chair of pediatrics at Goriab Children's Hospital in Morristown, New Jersey, and also the chair at Overlook Medical Center in Summit, New Jersey. And I'd like to introduce our guest speaker today. It's Dr. Cecilia DePentima. Dr. DePentima is the Director of Pediatric Infectious Diseases at Goriab Children's Hospital and Overlook Medical Center as well. She's a professor of pediatrics at the Thomas Jefferson School of Medicine in Philadelphia and has been practicing pediatric infectious diseases for over 25 years. So we're really lucky to have Dr. DePentima here today as our guest speaker. So without further ado, I want to introduce our topic for today, which is a topic that I think it's been on everyone's minds, and that is COVID vaccine in children. And also, we will spend some time talking about immunizations and the importance of immunizations in childhood. So, Dr. DePentima, welcome. Great to have you here. So let's start by discussing vaccines that are designed to prevent COVID vaccine and some general information. If a child is healthy, why would he or she need to be vaccinated against COVID-19?
Absolutely. Very important questions. And I think that the first step is to understand better how these vaccines work. In the United States, the vaccines that are approved for children 5 years of age and older are the Pfizer vaccines or messenger RNA vaccines. Even though these are vaccines that had not been widely used, it's a technology that has been worked upon for decades, for more than 15 years, for other infectious disease processes. So what messenger RNA is basically the little codes, the computer codes that allows our cells to build proteins. So the messenger RNA in COVID-19 vaccines basically code the signals that are required for our cells to produce that protein that is called the spike protein that is on the surface of the virus and is required for that virus to get inside our cells and then start multiplying. Without that, the virus basically dies off. So once the vaccine is given, our own cells starts making those proteins and basically teaching our immune system how to identify and basically halt infection. So vaccines are important in healthy children because even when the mortality in pediatrics is significantly lower than what we are seeing in the adult population, in the United States alone, more than 900 kids had already died due to COVID-19, and more than 40,000 kids had already been hospitalized for COVID-19.
And there's no way to predict which of those children are more at risk to get COVID infection.
Absolutely. We know in general terms, which is similar to the adult population, that kids with underlying conditions, for example, kids who already have underlying lung disease, kids with asthma, kids with cystic fibrosis, immunocompromised kids, kids who are undergoing chemotherapy are at higher risk. It's not necessarily the case. Everyone can actually, every kid has the risk of being hospitalized and potentially dying from COVID-19. And I think that it's important that when we look at percentages, we can say, okay, the risk of dying in a pediatric patient is 0.01%. That would be one kid in 10,000. But when that happens, it's 100% for that particular family.
Right. That's great. That's really clarifying. Now, I know a question that's come up is, what if my child has already had COVID infection? Do they still need to be vaccinated?
Absolutely. And the reason for that is because different than other infectious diseases, for example, if you have measles, your immunity will last, long life. But for COVID-19, it's a short-lived. So providing the immunity, the additional training for our immune system with the vaccine extend and improve that ability to fight natural infection, number one. Number two, not only kids but adults can have COVID-19 infection more than once. And that risk is significantly lower if you're vaccinated.
Great, that's really clear. So you already talked a little bit about how the vaccines are developed and how they work, but you know the term DNA comes up, and what I've heard some people ask about is, will this vaccine affect my own DNA? Is that possible? It'll change me in some way?
Yeah, that's a very important question. And the important thing is that our DNA, it's inside the nucleus of the cell. It's very well protected. Let's call it a high security area, okay? Hard to get in.
Good term.
Now, the messenger RNA doesn't get inside the nucleus. It gets into the little teeny tiny factories that are outside the nucleus. So there's no way that messenger RNA's vaccine can modify our DNA.
Great. That also is very clear. Another question that I've heard people ask is, can this vaccine cause infection?
Okay. No. And the reason why is because the messenger RNA only has the code for that spike protein, okay? Not the code for the RNA of the virus in order to get multiply. So the answer is no. The vaccine will allow our body to make these dummy proteins that mimic what is in the virus in order for our body to learn how to recognize it.
Great. Okay, I want to move on to a whole other area, and that's people are worried about vaccines, and I asked you a couple of questions related to that, but safety, side effects. So are the COVID vaccines safe for kids?
Okay, absolutely. Another critical question. In order to get vaccines approved, they go through a very detailed process where safety is the most important one, because it's not helpful to have a vaccine in order to protect us against an infection if the vaccine is not safe. So there is a very rigorous evaluation of the safety profiles of vaccines, and that has been the case for COVID-19 vaccines as well. And as of today, there have been millions of doses of vaccines given not only to adults, but also to children. And interestingly enough, it is important to mention that the dose of the vaccine is different in different age groups. So for adults, it's 30 micrograms, then the dose goes down to 10 micrograms. And in the current studies for kids under 5 is only 3 micrograms. So in the 5 to 11 age group, the vaccine was much better tolerated than in the older kids and adults, and that's probably related to the fact that the dose is lower.
Great. So I want to really emphasize this point, because I know there are some people that are just afraid. They want to protect their children, but they're afraid. So there was a lot of talk early on when the vaccines came out that they weren't tested long enough, and there could be great risks. And I think what you were saying is that even before those, very early on, they had gone through rigorous testing, and now we have so many more cases. Did I get it correct?
Absolutely. So first, not only in relationship with COVID-19, but there has been messenger RNA vaccines trial for Zika virus, for HIV, for cytomegalovirus. Furthermore, I think that COVID-19 had allowed this technology to flourish and highly likely will be used in different infectious diseases. We may see a combined vaccine for influenza and COVID. We may see more vaccination for pregnant women in order to protect the newborns. I think that it's an excellent technology and we will see more of it.
Great. Most people have heard about this thing called myocarditis. Can you just briefly tell our listeners what that is and how does it affect children?
Sure, of course. So myocarditis is a terminology that describes the inflammation of the heart, and it commonly caused by viruses, bacteria, and definitely by COVID-19 infection. Now, the main concern with messenger RNA vaccines on the Pfizer and Moderna has been reported cases of inflammation of the heart associated with immunization. However, it is important to emphasize that COVID-19 infection causes a much more severe myocarditis and much more frequently than the myocarditis associated with the vaccine. The vaccine associated myocarditis is short-lived, gets better with ibuprofen, and if you take 100,000 kids, in general, boys are more likely to develop myocarditis. 5 may develop myocarditis associated with the vaccine, but close to 60 will develop myocarditis with infection.
Wow, that's a really good way to look at it. That's a great perspective. And it's a milder illness
Absolutely.
if you get it from the vaccine compared to if you get myocarditis from COVID infection itself.
Correct. Whether from COVID or the multisystem inflammatory syndrome, kids may be in the ICU, and treatment involves corticosteroids, infusions, may be intubated. It's by far much more serious disease.
Yeah, okay, thank you. Can you tell us when you think there'll be a COVID vaccine available for younger children, the 6 years to 4 year age range?
The 6 months to
6 months.
the 4 years. There are 2 different companies working on it, both Moderna and Pfizer. Pfizer, as I briefly mentioned before, is using a significantly lower dose, and I think that had an impact on the efficacy of the vaccine, especially for the 2 to 4 years of age. So currently they are working on determining if a third dose will be indicated for that age group. Moderna is estimated to have the results probably in a month. So hopefully by April, we will have more information. We really need the vaccine for that age group. If we look at the mortality for that age group in New Jersey, out of the 15 pediatric deaths in the state of New Jersey, 11 have been in the 0 to 4 years of age. So critically important to have the vaccine available.
And tell us what you would recommend for the youngest children in particular, less than 6 months old, but even for ones maybe a little bit older. What kinds of measures would you recommend to parents to protect their children?
Again, very important question because it touched upon the importance of vaccinating pregnant women. When for kids under 6 months of age, their immune system is really immature. So during the last 3 months of pregnancy, they receive part of those antibodies, those proteins from their mothers who allow them to be protected until their immune system start developing and being able to fight infections on their own. And that is also the importance of childhood immunization during the first 6 months of age. So begin to teach that immune system how to work against the most severe pathogens. So the immunization of pregnant women is critical in order to protect babies up to 6 months of age. Number one. Number two, getting everyone immunized around that young infant. It's also important to protect the most young ones, that it's unlikely that we will get a vaccine for them because we know that vaccinating pregnant women is helpful for the newborns. And that's why we do other vaccines during pregnancy.
So I guess it goes back to the recommendation of making sure as many people in the population are protected so that they won't give it to those very young, vulnerable children.
Correct. That is important for those young infants and also for that percentage of the population that has underlying conditions and may not necessarily respond well to the vaccine.
Sure.
So it's what we call the herd immunity.
Yeah, sure. Very good. Okay. So There's been so much talk about the Omicron variant, and the question has been raised: do the vaccines protect against the Omicron variant of COVID infection?
Yeah, excellent question. Because it will be also something that will be in everyone's minds with new strains of COVID-19 will emerge. So with Omicron, very interesting, and looking at the pediatric population, there are different aspects that we need to look into it. Number one, what is the protection against severe disease versus mild disease? So early on, when messenger RNA vaccines were developed and we started getting immunized, the efficacy of the vaccine was over 90%. Over time, and with the emergence of new strain, that efficacy has dropped. However, when we look at, for example, 5 to 11 and the older teens, the efficacy against Omicrons for emergency room and urgent care visit dropped to around 40%. However, the efficacy for hospitalization was over 75-80%. When the 16 to 17 years of age got their booster vaccine, the vaccine efficacy against that emergency room visit and urgent care visits doubled, over 80%. So that gives you an idea. Number one, vaccine immunity also wanes. You need a booster. And now boosters are approved for 12 years of age and older. And natural immunity also wanes. And that's why it's so important to get immunized.
So it's just such an interesting point that about vaccine and how the immunity needs to be reboosted in order to make sure that one is protected. Do you think that we're going to need to continue to get boosters? Will there be additional boosters?
Time will tell, but the way that so far the COVID-19 pandemic has evolved, we highly likely need additional boosters.
And people are working on that now, or will it be just
Well,
the
there
same
has
vaccine?
been, yeah, no, I mean, they're already working on Omicron vaccines, which probably will not be necessary. But that's the beauty of messenger RNA vaccine. They can be easily modified to include, remember, what we talk about messenger RNA is that computer chip that has the information. So that can be easily changed so that the new vaccines have that code that corresponds to new variants.
That's great. That gives us all some optimism.
No, absolutely. I think that.
So I want to shift the conversation just a bit. As a pediatrician, I'm very concerned about the impact of the pandemic on the issue of childhood immunizations, of kids getting the needed immunizations against all the other childhood illnesses, not just COVID. What can you tell us about what effect the pandemic has had, and where do you see things going?
Yes, absolutely. We saw early on that with COVID-19 pandemics and offices being closed, kids just basically stuck in their houses, the rates of immunizations of childhood had significantly dropped. And that's not something that happened in the United States, but also worldwide, which is really worrisome because infectious disease pathogens travel. We are not an isolated.
As we saw with COVID.
As we saw with COVID, we had seen cases of measles, for example, in schools where part of the kids had now been immunized and kids bringing measles from abroad. We recently had outbreaks of measles in New York, New Jersey, and we forget how serious it could be to have measles. And not only in the short term for some vaccines, but others, for example, rubella. Rubella and some of the childhood diseases may not be as severe during childhood, but can be worse when you grow up. Pregnant women, if they develop primary rubella infection during pregnancy, they can have serious consequences to their babies. Pneumococcal vaccines that prevent against meningitis early on in life are so critical. Haemophilus influenza. So there are so many different vaccines that really play a critical role in giving kids an opportunity to have a very healthy and long life.
Yeah. So what would you suggest to parents? Maybe they have let their child fall behind with their immunization schedule. They weren't thinking about it. Their priority was protection against COVID, not going out, not going to the doctor's office. What would you recommend to them now?
I think that it's so important to have a close and good relationship with their pediatricians, discuss these different vaccines with their pediatricians, why they're so important, and if they're behind, what is the best way to catch up. There are different ways in which pediatricians can provide a catch-up schedule for their kids and for their patients.
Okay, good. So is there anything else that I didn't ask you about that you want to bring up that you think would be important about COVID vaccine or the topic of childhood immunizations in general?
My only message is that for those of us who have been in practice for such a long time and had seen the impact of many of these preventable diseases before they were available, I'm not going to tell you how old I am. It is critical that everyone pays attention to immunization in childhood. And these are gifts that really imagine if we would still have smallpox around. Smallpox was eradicated because of the implementation of immunizations. Polio.
Polio, sure.
However, we are now seeing number of cases of polio increasing in Afghanistan after the crisis in Afghanistan. It has now been eradicated from Africa. We don't know what the impact is going to have on measles and other immunizations, what's happening in Ukraine. So I think that, again, many of the diseases that are under control because of vaccines that can easily disappear if we don't keep up with the immunization of kids.
Yeah, and I remember that vaccines were considered the miracle of the 20th century, that they just completely changed the course of so many childhood illnesses, many which were really debilitating. It would be such a shame to have to backslide, to move back to a time. And as you pointed out, we've had some recent outbreaks of measles and other illnesses around. So,
no, absolutely. When we look at, we can argue that humans survive with no vaccines and no antibiotic therapy, but reality is that childhood mortality and life expectancy was significantly different.
Well put. Well, I want to just thank you so much, Dr. DePentima. You were just great and enlightening in explaining this, and really appreciate it. Thank you.
Thank you. Thank you.
So thank you very much for joining us today. And if you'd like more information, please go to the Atlantic Health System website. There's great information on there. Other resources are the Centers for Disease Control and Prevention, the CDC website. And I would really encourage all of you to look at the current scientific information, reliable information on the internet. It's out there. Make sure you go to trusted sources. Thank you very much for joining us.